and welcome to the show. You're watching Heads Up. Over the past few weeks, we've been bringing you stories of children with special needs when it comes to learning, from dyslexia to autism and much more. One thing that we noticed is that most of these children are excluded from society. So where are those organizations working towards inclusive training? That's exactly what we're bringing you today, the organizations and people working to bridge the gap through technology, identification and remedial measures. Here's a look. They aren't able to read words the way an average person can. They find it difficult to get the alphabet right. And sometimes they excel at math but are poor at communicating with everyone around them. These are just a few of the many symptoms that children with learning challenges exhibit.
A lot of people have highlighted this cause and that such children exist. Earlier, they used to be very happy wherever they were. Now, they're being pulled out, labeled, and they're being put into resource rooms and things like that, thinking that there is a problem. So what we need to do at this point of time is to differentiate between actual learning disabilities, if any, and abilities which may be causing a sort of a disability because the methodologies do not match. One thing to do with when you talk about dyslexics or dyscalculics and all this, they are just words. Okay, what really is the underlying cause is the way they perceive things. And if you look at them, their neurological makeup, it's very different. And that's why they're different learners. They're not disabled.
But, as Chetna puts it, not every child with minor difficulties in learning needs to be put into a special school or be isolated. And not every child who displays inefficiency while learning may have a learning disorder. Experts say that what's needed is an effective screening process.
I think research has sufficiently indicated beyond doubt that dyslexia can be picked up. Children who are at risk for dyslexia, they can be identified as early as 5 years, and best practice indicates that it's good to pick up this problem early, because then you can put into place timely intervention, and that timely intervention would lead to better outcomes, not just in their academic life so that they'll start doing better in their studies, but also later on in their professional life.
And that is exactly what Dr. Michelle and her team at Pearson India decided to solve. After months of research, they have developed a screening and assessment tool to use in schools. The kit, which consists of various tests, are administered to students to help identify and determine at what level of dyslexia a child is at.
Takes about 30 minutes to administer. It's utilized for children in the age group of 6 years to 11.5 years, and it assesses a wide range of skills that are considered by research to be involved in dyslexia itself. So the teacher is the person who can administer this assessment, and that's what's unique about it. So it's not restricted to specific mental health professionals.
The dyslexia screening test particularly consists of 12 subtests involving identifying pictures, solving puzzles and answering simple questions. The aim of the test? To help evaluate fluency in reading, writing, motor coordination, attention span, and even ability to reason. The result discovers whether your child is at a risk of a learning disorder.
After this screening is done, should the child be identified as being at risk, the usual procedure is you put in place a certain amount of intervention for a certain period of time, and these are specific strategies which are shared with this child and the parent by most commonly the special educator or the teacher if she is involved, and this is carried out for a period of time. And if the child is depending on the monitoring that happens and how much of improvement is made, etc., they might refer for a diagnostic evaluation, and that is typically done by a trained, qualified clinical psychologist, and that in turn will set off a number of different aspects of intervention, like a consistent, ongoing, what's called learning support for different subjects that they are considered, that have been identified as weak points, in this case, say, reading skills.
Not seen too many of these students at schools? Well, you're not alone. Most of these children with mild to acute learning challenges are usually sent to special schools. And there are an estimated 391 special schools in India that cater to their needs. Why? Mainly because India does not require schools to have special educators to teach students with learning disorders or other special needs. This is a far cry from what countries like the USA and UK practice.
I'm also able to see some systemic differences between the Indian scenario and the scenario in some of these other countries. I think the biggest difference that I see is one of expectation. It's very unfortunate, but a very large fraction of people in India who work with children with disabilities, whether it's parents or whether it's teachers or therapists, their expectation of the child's development is unfortunately lower than what is the case in, say, the American market or the European market. In America, any kind of assistive technology that is needed for a child in order to have a normal education and normal social life is automatically paid for by the government. The child doesn't have to pay for it.
The United States, for instance, has a federal law called the Individuals with Disabilities Act that mandates public and private agencies to provide early intervention and provides all services needed for those with special needs. This includes funding for education for children up to the age of 21. India, on the other hand, has only recently introduced the Rights of Persons with Disabilities Bill to the Parliament in February, after repealing the previous Persons with Disabilities Act.
There is a twofold change which I would really love to see in India. The first is I would like people to have much higher expectations of what children with disabilities can achieve. And second, I want to be able to see the government and various public organizations in India step in to be able to provide all of the technology, all of the assistance that is needed for these children to achieve their true potential.